wonderful friends from Doctor's Hospital. In fact, you know what? Let me bring it in because he's hanging out with me right now. Good morning, Doc. How are you doing? Introduce yourself to my public here.
Good morning. I'm doing great. My name is Kunal Goyal. I'm interventional radiologist at Doctor's Hospital. I started working on the island 6 months ago, and it's been going great so far.
So, Dr. Kunal, for people who never had to go that right, what is interventional radiology and fibroids? So, talk to me a little bit about that.
So, interventional radiology essentially is a subspecialty which has evolved globally over the last 5 to 10 years. And it uses minimally invasive techniques to treat various diseases. And we use keyhole techniques to get into your blood vessels, and that's how we do most of our treatments. And we use X-rays and ultrasound to offer us a very precise and accurate way to treat various diseases. And while I've been on the island, I've seen patients with blood vessel diseases with narrowing. I've treated patients with tumors in their lung and liver. But mainly, our focus has been on fibroid disease and its management on the island because we do know that Caribbean population overall has more incidence and more chances of having fibroids.
And that's what I was going to allude to. You know, our region consistently over the years has been one of these that's been plagued with fibroids for women. So how typical is the procedure? How is it performed? Just kind of walk me through a little bit of that so my listeners can have a more rounded idea of that.
Yes, for sure. So essentially, fibroids would initially be diagnosed because as a young woman, you would either have complaints of increased pain, increased crampiness, increased bleeding during your periods, or excessive bleeding in between your periods. You would go to see your family doctor or a specialist. They would do an ultrasound and diagnose you with fibroids. And in the past, the treatment for fibroids has been open operations, which would mean staying in the hospital for 3 to 5 days and then able to return to work in about 2 weeks. Now, with the interventional radiology embolization procedure, the patient comes in the morning. We do a little bit of blood tests to make sure everything is good. We go through a tiny hole in your groin into a blood vessel, and we can stop the blood supply to all the fibroids in one sitting, which takes us about an hour and a half. And for most of the patients, the procedure is relatively pain-free, and they are able to go home the same day or next day and resume their activities within 2 days.
So, pause. 2 weeks recovery time and surgical time versus 2 to 3 days.
That's absolutely correct.
Wow.
And there is no scar involved.
That's definitely a game changer. I'm sure that there's a lot of people out there listening in that's putting 2 and 2 together. Said, "Wow, this is huge. This is a very big deal when it comes to women's health and also the treatment of it." So with that aspect, what would you want my Cayman residents to know about this procedure?
I think the first thing is that if you are suffering with symptoms, get yourself diagnosed. And if you are one of those people who has a diagnosis of fibroids, I think you should get an interventional radiology consult because now the treatment is so much safer and pain-free that you should not be scared. Most of the patients in the past did not opt for the treatment option. Either they were worried about their fertility after the treatment, or they didn't want a scar, they didn't want to miss work for 2 weeks. Or for some people, surgical treatment was not an option because you can't treat more than 2 or 3 fibroids with surgery. So I would say to the people of Cayman that if you're suffering from fibroid disease, you do not have to suffer silently. You should seek help because with the option of interventional radiology and embolization procedure, you may be a good candidate for treatment which can be offered to you in a very simple and a pain-free way.
And that's what I was going to come back to. Being referred from their general practitioner to typically what questions could they ask, you know?
I think if the patients are suffering from fibroid disease and they go to their family physician, general practitioners or specialists, they should definitely ask if they would be a candidate for interventional radiology. Now, we are increasing awareness amongst physicians of the islands as well as to our presence now and what we offer. So they should be aware that this technology is available on the island. It was available in Miami in the past. So we are lucky then that we are able to offer it here. So patients should be able to ask if they have treatment options available. And they can even ask their family physicians and specialists to refer them to doctor's hospital for a consult, which means we can sit down with them, discuss them individually, and see if the embolization procedure would be good for them.
Exactly. And this is just one, this is kind of, it's a big thing, but kind of a small area because you do other things also. Allude to that a little bit.
For sure. Fibroid embolization is only a small part of my practice in the past. A lot of my practice is based on interventional procedure on other organs. So treatment of tumors in kidney, liver, lung, a lot of treatment for infections, treatment if you have blood vessel diseases, mainly if you have narrowing in your blood vessels in the leg or in the abdomen. We also treat patients who may have bleeding after trauma, and that's usually acute problems. But for over the last 6 months that I have been here and over the next 5-6 years as our practice evolves, I think we are going to focus on fibroids. But if you have other conditions, if you are unfortunately suffering from a tumor of the body, then interventional radiology may be able to help you with a non-conventional treatment, which is less invasive and easier to access now.
Of course. So folks, if you are in any sort of I want to say valiant thoughts, reach out to your GP and also reach out to the good folks over at Doctor's Hospital. You can go ahead and get inclination and information, because it starts with sitting down, having a conversation and figuring out what's going on. And then from there, you could talk with a doctor here and have a better understanding of your treatment and also your options, because that's the start of it.
Yes, for sure. I think the best we can do is we should not suffer in silence. We should address our concerns and take our health seriously and in our own hands and seek for advice and options available.
And if somebody wanted to reach out to you, doctor, how can they go ahead and do that?
They can directly reach out to Doctor's Hospital and make an appointment with myself. They can say they want to speak to Dr. Goyal. All the family physicians and the specialists on the island should be able to refer the patients to Doctor's Hospital because there's a standard referral process. So getting to me for a consult should not be a problem. And I have been offering consults to people over the phone as well who can't take a day off work. So taking advice is very, very easy, and I think everybody should avail it.
Exactly. It's as you said, no one should suffer in silence. We should be able to reach out and get professional thoughts and professional information to remedy the situation. Doctor, thank you so much, Dr. Goyal, for stopping by here. And folks, if you are in need of his service, please reach out to Doctor's Hospital. It's very simple, and start the process and feel better.
Thank you very much for having me. Everybody have a great day.
Thank you so much, Doctor. I appreciate that. More great music coming up on the way. In fact, I feel like I should drop something right now for you. Here's the 4 top